Now, I want to talk a little bit more about pain. I'm going to tread very lightly here. I have had a number of family members die under hospice care, and hospice is a phenomenal, just a phenomenal organization, and really dedicated to just incredibly compassionate care of people who are dying. And beyond just the people who are dying, also the loved ones, the family members of those who are dying. Hospice is just really, I can't say enough good about hospice. And just the all encompassing way that they approach death. They're addressing emotional as well as spiritual needs of the people who are dying and their family, and even beyond death, the grief needs for people who have lost loved ones. One of the things that hospice does, which is wonderful, is they seek to help people have a pain-free death. For the most part, at this time, the biggest way to have a pain-free death is through pain medication. Oftentimes, we will have physicians who are also seeking to do the same thing, which is ease the pain or the fear or the struggle of death. And so things in addition to pain medication will be prescribed. Antidepressants, sleeping medications. All of these have their place, and the people who are prescribing them are very well intentioned. We, as individuals, with our own free will, need to make choices because the medications do not come without drawbacks. And one of the drawbacks of the medications is that we are not always fully present. We are not always fully lucid. And so in some ways, we lose some of ourselves, some of who we are. And I'm sure anyone who has, not anyone, some people who have seen deaths where people are heavily medicated have seen this. And each person gets to choose for themselves, because some people want to go out feeling really medicated and not feeling a thing. And that is perfectly fine, absolutely wonderful. And if that is their form of peaceful death, that is absolutely how they should do that. Other people might want to go out being aware. And the price for that awareness might be feeling some pain. Or the price for that awareness might be feeling some sadness. Because it's reasonable and understandable that if we have been battling an illness, that we might feel depressed because of that illness. And maybe our soul needs to experience that and process that and work its way through that. Or maybe it doesn't. And maybe we choose to take an antidepressant. The thing that I'm trying to get across here, the thing that we want to recognize, is that it is absolutely up to each individual, not their family members, not their loved ones, not their physicians or their caregivers. Each individual gets to make this choice for themselves. And then it is up to the family members, the caregivers, the medical professionals to support this choice and to facilitate this choice, even if it makes those of us who are in supporting roles, even if it makes us uncomfortable. It might mean that we have to sit and have more conversations, more difficult conversations with our loved one or our patient who is dying. And it might mean that we need to, rub their hands and feet a little more and bring cool cloths for their head and be with them if they have chosen to be in pain. Because we have to watch, when it's not our death, it can be really uncomfortable to watch someone else be in pain. But what's important to recognize is that if that's their choice, the most loving thing that we can do for them is to honor their choice and support them in that choice, even if it makes us uncomfortable. It's a great gift that we give them. And we can always ask, are you still comfortable with this choice? You can change your mind, and whether you do or don't, I support you either way. And that's our role. That's what we do if we're the caregiver. We inquire and make sure that this is still the choice that they want, and let them know that it's their choice and we support them either way.